If I met a patient who said, yeah, I've been making my own hyaluronic acid in the basement, but I'm sick of doing that, will you do it for me? I'd be like, sorry, because I have no idea what's in your skin. Welcome to the Aesthetics Mastery Show. I'm Dr. Tim Pearce.
Hi, I'm Miranda Pearce.
And today we've got some really exciting results from our first survey where we're going to look at the distribution of filler choice across the globe. So we've got some really interesting data about which fillers you guys are using. Then we're going to discuss how you should choose your filler, how you actually choose your filler, and what I suggest we look at in terms of reactivity in different filler types.
So this all came from the COVID vaccine and people saying that 3 people had reacted, they had filler present, and so you thought, let's get some data. And this is the first tranche of the data, isn't it?
Yeah, so we're going to survey our entire list and work through other people as well, so hopefully get as big a data set as we can, and we're going to try and find out what proportion of different fillers are reacting. So if we've got this very unusual, very valuable situation where we know a lot of people are going to be exposed at a set point in time to an inflammatory situation, which is what all vaccines do, and then we can measure reactivity. But you can't do that unless you've got a list of all the different products people are having. Now, one of the things that first frustrated me about that initial report is we have no idea how many people in that study of the vaccine had dermal filler in their system. We have no idea what filler was in the system and then caused the reaction. And we have no idea about the medical history of those patients who actually had the vaccine. So what we're going to do is try and do our bit to try and sort some of that out so that we can hopefully get a little bit of insight into what are the factors that predispose people to reactivity. And as we said last week, I need your help for that. So do get involved. There should be a link with some more information below this video.
The first link that we put through last week, though, was we asked you guys what filler you used, and we found out some juicy information.
Yeah, so we're going to go through what the world's most popular fillers are and what you guys are actually using in your clinic, and see if we can see any interesting insights between the type of filler and the volume of injecting that people are doing, because all of this should help you choose wisely with your product choice. And then we'll also talk about how I think you should choose your filler.
So tell us about the survey.
So we managed to get responses from over 52 different countries, which I'm really pleased about. When you look at the map, it's most of the globe's surface, apart from the oceans, which is pretty cool. And then we got 2,106 responses. Obviously, we are predominantly UK heavy, so 60% of those responses were in the UK, and that might help you interpreting this if you live elsewhere. But there is definitely some interesting data coming from it. And if you want to dive in deeper, we are making all of this raw data available in the link down below. And if you want to create some content out of it, don't forget to share us. Maybe I'll even have a discussion with anyone who comes up with any interesting insights. Just inbox us and let us know.
So tell us how the filler categories broke down.
So the question that we asked is, which is your favorite filler? And we got hundreds of different responses, thousands of different responses, and many small niche products, which we haven't listed. We're starting at the cutoff of 1% popularity, and that is Radiesse starting out. It's a non-hyaluronic based product, and that's the only one that is non-hyaluronic acid based in this survey result. Next on the list is Versa, and that represented 2% of responders. Then we have Stylage at 4%, Bellatero at 6%, Revelax at 10%, Restylane covering 16% of responses, Teosil at 17%, and then Allergan, if you take the company as a whole, is 30%, but you can divide that up into Juvederm Ultra at 10% and Vycross Technology at 20%. So the most popular filler by volume in our survey was the Vycross range of dermal filler products.
So obviously the majority of people who responded were UK based. So a filler like Versa, for example, which is made by Plenum in Canada, I'm sure if we asked just the Canadians, that would be more popular. Yeah,
well, there were certainly some interesting things we'll get into in terms of the volume of use. So we looked at how much volume each brand was being used. So if a clinician favored a particular product, how much were they injecting in an average week? And Versa was represented quite highly in some of those more niche numbers. So it was one where there were clinics using huge amounts, essentially, with that brand. And that's actually not true with some of the less common brands in the rest of the survey. And I think there's something in that, which is, I think it probably fits a different niche when you look at it from a North American context than what we have more European centralized. And I'm sure they're working hard to change that.
What did we learn about the volume of filler people are buying?
So it's no big surprise that the bigger accounts dominate the brands, the more famous brands. So 50% of the biggest accounts were Allergan. So that's Juvederm and Juvederm Vicross. And then we had represented as well with one clinic each, Teoxane and Galderma, Fox Pharma with Revelax, and Mertz. So it's an interesting distribution at that higher end, which is worth thinking about.
So what you mean by that is that the people who were purchasing between 5,000 and 10,000 ml filler per month, they were with the big filler brands.
Yeah. We could hypothesize why that is, whether it's a rational choice or whether that's the support they get from the team, whether it's a sales effort by the companies themselves who know who the big accounts are, whether it's experience that makes you choose certain products, whether it's just the cost of the product. There are many different factors that come into play.
Okay. So let's dive into, if someone's watching this here and they may be quite new to aesthetics or they're thinking about changing brands, how can we make a great decision about which one of these brands to choose?
Well, it's really difficult, because if you were going to make a purely clinical decision, you'd need a lot of data, and you'd need a table that compares every different characteristic, and then you would choose a product that best matched the need that you had for that product. So, for example, you'd have the cohesivity of the product, and there'd be a number that you could look at and you compare it to the other products, and you'd know that you want a high cohesivity product for some areas and maybe something softer for others. You'd know about reaction rates, for example. You'd know 0.5% chance of this product reacting, for example. You would simply look through that table and choose the safest, most effective, longest lasting, most predictable product, and then you would use it. Now, unfortunately, we are miles away from that. That is not how anyone chooses products, because it's incredibly hard to even get close to that table. The data would be very hard to get. I've been thinking, for example, as G prime. G prime is spoken about quite a lot as a desirable feature, but we don't actually know what it is in the tissues. Like, we know what it is in a test tube, but it's completely different in the tissues. The interaction between the molecules in the tissues will completely change that product. And so it becomes about experience. Now, I know certain products that when I put in a certain amount, it seems to project out in a way that's better than other products. And it's an experiential thing that I really firmly believe, but that's not science.
And if we were thinking about complications, again, what kind of questions might we ask ourselves to decide which filler to get?
Yeah, so there are lots of different variables you would look at in terms of minimizing the risk of complications. So firstly, you'd say, is it dissolvable? Regardless of what the molecule is, can you get it out quickly if you need to? You might also want to be looking at, in terms of the safety process, does it aspirate well? Because some products, it doesn't matter how long you pull back on the plunger, you will never get blood back in. And that is another feature that you might want to think about when choosing your product. If it aspirates well, but you can still cause an occlusion, obviously, you need to know, does it dissolve well? So there's another feature we just don't know, like how much hyaluronidase does it take to dissolve every filler? And these are some of the many questions I would love to get answers about over time. But you're looking for an ideal product, but there's always a payoff. Like you never just get one factor without paying somewhere else. I'll tell you one example of that, which is definition versus volume. If you have a really good product at creating definition, you usually can't create as much volume with it. And if you get something that's really great volume, it's usually not so good at creating definition. And there's always this trade-off. And that is true with all these characteristics. And
of course, the patient is a very important deciding factor as well, so that you can just consult them and decide what will be right for them.
Yeah, well, for the patient, often it's about cost, and they don't understand these factors anywhere near in as much detail. For the clinician, sometimes it's about how nice it is to inject. So do you have good control of your syringe, or is it, there are certain products I've used which are, you have to push very hard to get it going. And sometimes the most annoying feature would be that there's an inertia in the syringe. So you're pushing and nothing happens, and then suddenly it gives. For me, there are a couple of products I've used over the years that are a bit like that. And that, for me, that's just intolerable. So even if that was perfect in every other way, I can't sculpt with that because it's too unpredictable. It would be so lovely if we just say this is the best filler. But there are, and I haven't even touched the surface of how many different characteristics you might look at. But you should attempt, I think safety would be first. And then you want to have a sense of the predictability. Like, if I create this today, what will it look like in 3 months' time? And that is, you can only get through experience. I believe when you ask someone on a forum, which filler do you recommend? We know from our survey, the majority of people use very small amounts. So more than 50% of our survey use less than 10. So if you're per month. So if you're getting advice on a forum, you're probably statistically likely to be getting advice from people who use smaller amounts. And that doesn't mean that their advice is wrong, but they definitely have less experience. And also there are many new injectors in the UK, so they haven't been injecting for 10 years. Probably anyone who's injecting only 10 a month has not been injecting for 10 years. So the advice is based on what it's like on the day. When I inject, does it feel nice to inject, and do the lips look like I wanted them to? That's a very, very small part of what makes up a filler. The most important part is actually what happens after that. How does this product behave? Will it react? Will it cause a complication later? Can I easily reverse it? Will it diffuse or migrate from where you've placed it? Will it still be there in 3 years' time, causing a problem? Will it disappear in 3 months' time? It's the long-term behavior that actually makes more of a difference, I think, to patients and to patient safety than how it looks on the day. And unfortunately, that's very hard data to get. In fact, what you mainly get is experience. And when you talk to an experienced clinician, it's very hard to get experienced in 10 different filler brands. You tend to get experienced in one filler brand. And so it's incredibly hard to make a digital decision. You end up making an emotional decision. Which one are you familiar with? Which one does your friend use that you trust? Which one have you heard of? Which one is FDA approved? I do advocate for that in the UK because, there's some data behind it.
Which one do you use?
So we use primarily Vicross.
Juvederm
Vicross, and some Juvederm as well. I would only use Vicross if I could, because I just mean it in terms of the other Juvederm range, because I feel it's got that really good balance between definition and volume, and I know it retains definition over time.
And can we mix fillers in one face?
There's no data to say there's a problem with that. So most people will make a first principle decision, which is these fillers are so similar that it's very unlikely that there's going to be interaction. They're basically mainly hyaluronic acid. And even if it's not hyaluronic acid, is there any chemical reaction that you can think of? Probably not. So without data, you make a first principle decision that is likely to be safe.
I heard that there were some insurance companies said that you should wait a certain number of months.
Yeah, I've heard people say that. Now, what we know from interviewing Dr. Master and from his studies, that if you ultrasound people even 3 years after, most people have got filler still in their system, even though they will say they can't see it. And I'm not surprised by this at all. That was my clinical experience long before I had the proof from Dr. Master, is that these fillers last much longer. So for me, it's not rational to say you should wait 6 months before you mix filler, because you probably should never treat that patient again if you want a clean slate with every patient and you want to only have one filler in their face. It's just not practical for most of us. If you happen to be one of these, and I have heard extremely well-known injectors saying they won't treat anyone who's had treatment elsewhere. Now, most of us do not have that luxury to be rejecting 50% of your patients. Now, if you have a queue and a waiting list 3 years long, maybe you can do that. But most of us have to be reasonable and make a risk assessment. Is there a known problem? No. Could there be a problem? Possibly, but is it likely based on what you know about those products? No. If there is a problem, what are you going to do to solve it? Well, we're going to use hyaluronidase. If it's a hyaluronic acid filler, it's very similar to whatever you're using on the day. Then I feel like it's reasonable to mix products in a practical sense.
The other thing that we used to say, and this is going back years, is that you shouldn't mix products because if you did, then if there was a problem, the manufacturers would say, well, it's not my filler, Gov. And then the other manufacturer would say, well, that's not my filler. How do you know? But again, I feel like that's maybe moved on a bit, because I'm not sure that the manufacturers sort of do all that much to help in difficult situations anyway.
Well, the thing that you're really worried about in that situation is someone buying stuff off the internet or injecting themselves. We've got an interesting case I came across of someone making up their own hyaluronic acid gel out of some powder that it was for topical use, and they're injecting themselves. Now, if you're injecting someone who's done that, you have no idea what's actually in their skin, and you may get some sort of reactive process that's impossible to solve, that causes horrible nodules that are permanent, that start 4 months after you do your filler. So if there's that degree of uncertainty, if I met a patient who said, yeah, I've been making my own hyaluronic acid in the basement, but I'm sick of doing that, will you do it for me? I'd be like, sorry, because I have no idea what's in your skin. And when you have a problem, or if you have a problem, I won't know what to do. And we won't know if it's my product or yours, and I'll be lost. So for that reason, I'm out of that situation. So that's very different. But I'm talking about a good patient who's gone to reasonable clinics, who's had a different brand of product, that is within the realm of risk I'm happy to take.
But maybe not to mix types of filler like Radiesse, Sculptra, hyaluronic acid.
Well, even that, if you know what you're dealing with, you can get around some of it with documentation. Now, some of these products, there is a different type of reaction you may get with Sculptra. I've certainly seen a patient with reactive nodules. I think it's less common now than it used to be, because I think they either changed the formula or how it's administered. But anyway, if you've got a good documentation of where the filler is placed, and Sculptra is usually placed differently. That's one case we had. We knew it wasn't ours because we had a good documentation of where our treatment was and where the reactive nodules were. You could still, but you're right, it's into a slightly different realm of risk when you're mixing different categories of filler, which may have different reactions, particularly if that reaction is harder to solve. A permanent nodule is a much worse problem. And if you're injecting something that may cause a permanent problem in a year after your treatment, then you're taking a significantly bigger risk than if it's just hyaluronic acid, the same as what you already use.
So how does the choice of filler affect the vaccine survey?
So if we're going to look at people reacting after the vaccine, it's going to be very helpful to know what type of filler they've had. And the reason for that is because not all fillers are equal. And the main reason for that is that they're all made differently, and they've literally got different things in them. And there has been some pretty high profile discussion around different products. I know the Vicross range has had some question marks around whether it's more reactive or not. And we actually audited all of our patients and found it was 0.4%, which was 0.5% was what's predicted. So I did not find that in my patient cohort, but it's something you will see on social media all the time. And a lot of high profile people will discuss it. What a great opportunity we've got to actually see if that's true with this particular exposure. So that's why I'm interested in it. We need to pin it down to different types, but there are lots of components about filler and even the way it's administered that could also affect inflammation. So although we'll get back some data, it won't be without further questions. It never is, isn't it? More research required, as they always say.
So what are the factors that affect reactions to filler?
Well, the way I see it is reactions to filler are broadly about an inflammatory state. So what are the things that cause inflammation in patients? And those are probably going to be similar to the list of things that cause inflammation with filler. Now, the type of filler is obviously going to make a difference too. There is some interesting evidence that short-chain hyaluronic acid fillers or not hyaluronic acid fillers, but short-chain hyaluronic acids are pro-inflammatory. They actually cause an inflammatory response. But long-chain hyaluronic acids are actually anti-inflammatory. So, and this is just to do with the science. There are actually receptors within cells that detect hyaluronic acids and respond to them. So there is something about the actual molecule, but there might also be something about how it's all glued together. So, all these fillers are made slightly differently. We have the Nasher technology, and we have Vicross technology, and we have BDDE, and there are various components that are added to hyaluronic acids that may cause a problem. And there are also the possibility of impurities. All hyaluronic acids are made by bacteria and then is purified, but there is a small chance that some will have a higher concentration of bacteria cell walls, which could cause reactivity in theory. So it would be very weird if there was no difference between dermal filler brands. I mean, everything, if you put something through a vastly different process or even a moderately different process, it's likely that you're going to get a slightly different result. And that doesn't mean that one will be unsafe and some will be safe. It just means there'll be little differences between the two. I don't think you're going to find one that's 100 times different to the other. I think they'll be within a few percentage of each other would be what I'd guess. We'll find out. But that's because they're made differently. So that's the actual product. You've then, of course, got patients. You've got to also recognize that if you have a patient who's already inflamed and then you inject them with the filler, it's way more likely that they're going to become inflamed due to the filler. So autoimmune disease, allergies, dental work can do it. So if you have dental work, you get a temporary bacteremia. So bacteria literally enters your bloodstream and your body responds to that and you get inflammation. So having a dental procedure might cause a reaction with your filler. Having a viral infection, and of course, the thing we're interested in most, having a vaccine. These are all things that may trigger a response to the filler. So we need to try and dissect what is related to the vaccine and the filler and what is related, what are the other risk factors that inform that? Because we want to try and make sure that we can separate the other risk factors out and look at just those healthy patients with no risk factors who have a vaccine, have filler in their system. What is their chance of reacting? I'd like to find out. So guys, don't forget to click on the link below and register your interest for the next wave of the survey. There's some amazing data that we can get if we all pull together, and I really need your help. So click on the link, register your interest, and you will hear from us shortly.
Thank you very much for watching the video, and please don't forget to subscribe and hit the bell if you want to be notified when we go live with more amazing aesthetics mastery shows.
Thank you for watching.